Hello everyone, today we will talk about hidden figures or those unexpected saboteurs of your skin health. So products or ingredients that you are using on regular basis that's supposed to provide you a benefit, but in fact, they are doing some damage to your skin health. So we will start this series with the eyelash lengthening serums. So without further ado, let's start looking into these products. So what are the eyelash lengthening serums? So the most famous one and the more active ones are those ones that contain prostaglandin analogs, and more specifically, because prostaglandin is a large family of lipid-derived hormones, prostaglandin F2 alpha analogs. And this has been used for ocular hypotensive as ocular hypotensive agents, so for glaucoma. And what they observed is like when they were doing the clinical trial for these, analogs, they were using, one eye was the placebo, the other eye was the one with the analog, with the prostaglandin F2 analog. And they observed that the one that was treated with the analog show a significant increase in the lengthening of the eyelashes. So it was a side effect. And voila, basically with that observation, they started developing these eyelash lengthening serums that became extremely popular and now are very well known, and they control the market. So when you look at the list of ingredients of this serum, you will not see the word, actually, the prostaglandin F2 alpha analogs, but you will see the commercial name that are listed here that I'm pointing out. Those are basically, like if your serum contains this type of ingredients, it means that contains prostaglandin F2 alpha analog. So what are prostaglandins? So prostaglandins are very potent lipids hormone, and they activate, cell signaling. They also, like promote cell growth, differentiation, and apoptosis. And what is beautiful of this prostaglandin is that they can be produced very fast. So we say that it's a very unique type of hormone because it's lipid derived. So what that means is like the lipids that you have in your membranes can be caught by the activation of an enzyme that is already there. And in a matter of seconds or minutes, you can have a large amount of prostaglandin because everything is there. It's not like when you need an expression of a protein, basically, that requires hours for you to have a significant amount of that protein. Here, everything is ready to go. So prostaglandin are very unique, cell signaling molecules because they can produce very fast, and they can basically produce very fast in large quantities. And these most of them tend to be pro-inflammatory. So many years ago, when I was, looking at this eyelash lengthening serum, I was surprised that they were using a prostaglandin analog to do this. And I was like, this is pro-inflammatory. I'm pretty sure that is something that, can go wrong here. And that is what we will talk today. So as we mentioned before, these serums have been in the market for a long, long time. And there are several adverse events that have been reported. This is for the eye, for the eyelash lengthening serums, as well as for the glaucoma medication that use the same active ingredient. So I highlight here two of them that are the one that we will focus today. One is the darkening of the skin around the eye. So you may have longer eyelashes, but you can have dark circles, or your upper eyelid can be, darker. And fat atrophy around the eye. Fat atrophy means that you lose or you decrease significantly the level of fat that is around the eyes. And we know that that produces hollow eyes, and, it gives you a look of, aging, that your skin is aging. You can trigger, sagginess for lacking of fat, and also wrinkles. So none of these adverse, effects are well desired, especially if you're using something that is for cosmetic reason to have longer eyelashes, and you are ending with dark circles or with a hollow, eye socket and looking older than when you started. So let's talk a little bit what, this prostaglandin do, like in the skin. So prostaglandin are produced in response to harmful situations, for example, UV light or inflammation. So we say that they are anti-inflammatory, they control the process. They are the first mediators to be produced because what we just said, they can be produced very fast. Keratinocytes are the main producers of prostaglandin, and they respond autocrinically. So what this means that the keratinocyte produce the prostaglandin and they modify their behavior according with the prostaglandin that they produce. And they can change their proliferation and differentiation. So if you have a wound and you need basically to have more proliferation and more differentiation to seal that wound, those prostaglandin will promote that. What is interesting is like prostaglandin are receptors. So what allows a cells to respond to prostaglandin are also present in melanocytes. So melanocytes are the cells that produce pigment, more specifically, melanin. And these melanocytes in the skin have prostaglandin receptors that can detect prostaglandin E2, very famous one, very pro-inflammatory, EP1, EP3, and of course, prostaglandin F2 alpha. So our melanocytes in the skin have the capacity to respond to these prostaglandin F2 alpha analogs present in your eyelash lengthening serum. With that, let's look at some of the evidence that is available. So this is a study that was done in vitro, so using culture of melanocytes, and they were treated either with prostaglandin F2 alpha or with the analogs. And what they observed is an increase in the amount of tyrosinase. So tyrosinase is the key enzyme that produces melanin. So the amount of tyrosinase increased, but also when you measure the activity also increased. So what this means, it means that this prostaglandin F2 alpha, either the prostaglandin itself or the analogs, are able to produce or promote melanin production by these melanocytes. What is very interesting is like the same molecules are able to increase the number and length of dendrites in melanocytes. And this is very important because when a melanocyte is getting ready to transfer melanin to keratinocyte, it's formed this kind of fingers that goes and patch a large amount of keratinocytes around, and or gets very close into proximity. So melanin is moved through these fingers and gets transferred to melanocyte. And once melanin is transferred to melanocytes is when we can see it as a, either a smooth tanning or dark spot or blemishes. So not only is important for melanocyte to produce the pigment, but also to express this large number and very long dendrites. And what we observe in this paper is like there is an increase in the amount of dendrites, so numbers of fingers that this melanocyte express, as well as the length of this. And in the next slide, we can see a beautiful picture in which we see the control. So this is how melanocyte looks, in cell culture. When you add prostaglandin E2, which is a very well-known prostaglandin that promotes dendritic formation and pigment transfer, you can see how the shape of the cells, change significantly, and they start getting, these fingers around, ready to transfer pigment. What was very interesting is like when you add prostaglandin F2 alpha, you see the same effect. You see the formation of dendrites. So these, analogs not only promote pigment production, but also the transfer of this pigment into keratinocytes. So the issue with this is like, because you are applying this in your eyes and your skin around your eyes is very thin, you can have a very easy, way to stimulate basically the production of melanin in your around the eye area. So you can end with dark circles around your eyes if the liquid, is touching the skin there, because this is something that you use every day for many, many years to maintain the length of the, the long eyelashes. So you can develop dark circles. So if you are using this product for a while and you start seeing a darkening of the skin, because of this, is something that you need to take in consideration. Maybe is your eyelash lengthening serums the one that is producing this effect. Okay, so let's talk a little bit about periorbital volume loss. And this is a well-established, side effect when you use the prostaglandin analogs to treat glaucoma. So one of the things that glaucoma is basically needs to be treated for life. And with these analogs, usually, you put the drop inside your eyes, you blink, and the liquid goes, the excess of liquid goes all over the eye. So this patient, because are like decades users of these drugs, they start showing, like a significant loss of periorbital volume. So hollow eyes and looking older than they actually are. So one of the things that we observe when we look into the data that is published about this is like when you treat, adipocytes. So again, this is a cell culture with prostaglandin F2 alpha or its analogs, you see a significant amount on the number of cells. So you started with a certain amount of adipocytes. You have basically, like a control plate without these analogs or without the prostaglandin F2 alpha, and you see that the one that is treated ends with a small amount of cells. It's not that the cells are being killed, it's just that they are not divided, they're not being, they're not replicated. In addition, if you measure the amount of oils that you have inside the cell, because what it makes an adipocyte is the amount of oil, the amount of fat that they have inside their cells. And you can do it using a very cool technique that use oil red Nile. So you will see all the, the stain in red. You can see that these cells, you not only have less amount of cells, but these cells are skinny. So they have less lipids inside. And less lipid inside means, what this means for your skin. It means that you will have a thinner layer of fat under your skin, and hence the skin, can be saggy. So not good for your skin. There are some other, papers that show these similar effects, but now in clinical studies. So in 2022, this paper was published, and they show the effect of eyelash lengthening serum containing prostaglandin analog, and the subjects show a thinning of the skin. So after 10 months of usage, you start seeing, what is, the skin is getting thinner, and the area around the eyes is thin already and produce a lot of, issues, because dark circles can be seen better because of the thinning of the skin. And the good thing is, like, these changes can be reverted after 6 months of not using this. So at least, with acute changes in the skin, you can revert it. If you are a user of this for many years, we don't know if this effect can be reverted without intervention like fillers or lasers or other procedure. In 2015, they also showed that patients that were using prostaglandin F2 alpha analogs has a statistically significant increase in the incomplete, abnormal, and like closure of the eyelid redness. So that is telling you that is, a certain level of inflammation, redness, and the eyes sinking deeper into your eye socket. So basically, that is what it's telling you. It's like kind of like the loss of the fat. So you can see that in patients that are using these analogs. Another paper basically showed that, more specifically, one of the prostaglandin F2 alpha analogs can be used as a non-surgical alternative to treat diseases that lead to orbital or periorbital hypertrophy of, of the fat. So those conditions where you have like a bag under your eye that is full of fat can be treated with this. So they are so effective, these prostaglandin F2 alpha analogs, to destroy the fat, that they can be used to, destroy, basically without the intervention of a surgeon, the accumulation of fat around your eyes, that very thick and, like a saggy bag under your eye that is full of fat. So with that, we have plenty of evidence that these eyelash lengthening serums can basically affect the health of your skin around the eyes, so be careful when you use it. There are alternatives in the markets that don't contain these analogs. I'm not sure how good they are to produce, like to increase the length of your eyelashes or to maintain that, but it's something to consider if you are having issues with dark circles that you never have before around your eyes, or, like you are starting, to see that your fat layer around your eye is decreasing. Pay attention to this, because this serum, this eyelash lengthening serum, can be responsible for aging you faster, instead of giving you a beautiful look with longer lashes. So if you have any question, put it in the comments below. And also, if you want to contact me, this is my social media. Thank you.